first met you, I was blown away at how clinically strong you were, coming off as a intern. Back in the day, we called it intern, not associate. So when I met you, I was like, this woman's going places.
When I first came into the agency and met you, I was very intimidated by you. You had such a confidence in how you presented, and your demeanor was very direct, but I respected that, and that's, I think, why I kind of was drawn to you during our process of getting to know each other.
You know, one thing I experienced in the industry was big, giant egos, and I was like, wow, okay, this is a lot. And rightfully so. You know, people that are very clinically strong, have years under their belt, have every right to feel confident in their abilities, which they should do that. I think at the same time, being a newbie therapist, you know, now more than a decade ago, I experienced a lot of that pushback from therapists that were not women of color. And so that's why I say, when I first met you and you entered, I was like, I can learn so much from you. And even though I was a licensed therapist, I leaned on you, and you were not licensed at the time. And so I think for me, I was like, I can learn so much from you, not just because I have this paper that says you're licensed and now you should know everything, because you and I really don't have an ego with each other. We just say, I don't know this, what do you think? You know, and I come to you for that, and you tell me non-filtered version that Val is, which I appreciate so much about you, because I think that's the best thing about your personality is, I say, give me the cold hard facts, and you give it to me, and it helps me ground myself, but also make very rationally based decisions too.
I had a particular client who was of Hispanic origin. I totally connected with this person, and when they were talking about interventions, and she was talking about going home to her family, and this particular house was very eating disorder focused, dual diagnosis. And so when I brought this as part of the process to my supervision, it was very cookie cutter, set boundaries. She needs to learn how to say no. She needs to be able to, assert herself, which is there's a hierarchy in the Hispanic culture where we don't just go in and set boundaries, and we don't just go in. And so you being Indian, when I was able to bring that to you, you really did encourage me that even in an environment that is very rigid and regimented, where it was a one size fits all, that I could have the ability to go in there and start to break down those barriers. And you being in that director role, I felt even more confident, because you were like, I'll talk to who I need to talk to. Like, I'll make sure that we're getting culturally competent, supervision. We'll make sure that this happens. So I felt a sense of empowerment to go there, knowing that you had my back through the process, which was really cool.
For me being a woman of color and you being a woman of color, we kind of came into this sort of process and eventually our relationship where I think we really bonded in that, because we know how hard it is for not only ourselves as women of color to find that support that we need. And so I think that is what also continues to bridge our relationship stronger, as being two women of color in a very, difficult sort of city where there's not a lot of women of color that are therapists. And I think that's one of the reasons why we impact our clients so much too.
For me, showing up as my authentic self, like Crocs, sweatshirt, hair up, don't care, like, you accept me for who I am in all aspects, and that's not something that's easy to come by in friendships, in professional relationships, and so I get it in both worlds, which is really cool.
My, connection to you, Val, as you being a fellow mom, is like, not only can I use my unfiltered frustrations with you about, the good and bad sides of motherhood, but you come to me from such a non-judgmental place when I say, like, I'm feeling guilty about this aspect of being a mother, and you humanize that so much.
When we worked at the hospital and I was going through like the diagnostic process with Berlin, and my daughter was diagnosed with autism, dyslexia, ADHD. There was a lot going on, and I had so much mom guilt for not being able to be present with her after school to do homework and all of those things. And you like soothed that part of me that was like, I should quit, I should do this. And I know that was a lot of the jump for me to go into private practice. And when I had came to you in that conversation, your mind went to my girls and me being able to be home with them more and to be present at nighttime to do all the things. I feel like for me, that was, I knew all along you were my friend, right? But I think that was what solidified, like, this person, you have my back, unconditionally, family first. And as a therapist, navigating that situation was hard because I had so much guilt. If I would have caught this sooner, if I would have seen this, sorry.
The first thing I remember I said these words to you is I said, what a blessing it is for your daughter to have you as her mom. Like, you have trained in this field as a therapist, and she gets the best mom out there who knows so much information, so many resources. And that's why I was like, do this, do it. Go start your private practice, go full force, because you're gonna do so much to help her, and not only her, but be successful on your own, start your business and do something that I am still scared to do to this point, where I still have my fears with taking that leap of faith. But you're right there behind me, continuing to encourage me all the time, every time I see you.
I think if I would have been working for a man, someone who wasn't a mother during that whole fiasco of a journey, I don't know what I would have done, because I think you being a mom and knowing my children, that was everything that I needed, that support that you gave me. I mean, the way you showed up for me, I don't trust a lot of people, but that was it. I think we both work with populations that have a lot of stigma attached to seeking mental health treatment, and breaking the stigma, right? That's the biggest thing. I think seeing women of color and women in general in these roles is helping, and we are breaking a very long cycle. And I hope to see more of it and more of us as that continues to grow.